Good morning, everyone. I am Mike Stratton with Boulder County Public Health. Thanks for joining us this morning for today's media availability with CU Boulder, Boulder County Public Health, and the City of Boulder to answer questions about COVID-19 in Boulder. Before we get started, we have a few logistics to go over. All attendee lines will be muted throughout the call. Please note that this session is being recorded. We will have a Q&A session after a couple of introductory remarks. If you have a question, you can raise the participants icon at the bottom of your screen and raise your hand in Zoom, and we'll call on you. Unfortunately, we may not be able to get to everyone's questions, but we'll give you a mail-in option by email if that's the case. Okay, let's get started. Thanks for joining us today. The focus of today's session is the recent rise in new cases in COVID-19 in Boulder County. We'll get started with a few remarks from Jeff Zayak, Boulder County Public Health Executive Director, followed by Phil DeStefano, University of Colorado Chancellor, and then we'll take questions for Jeff or Chancellor DeStefano. Also joining us this morning and able to answer questions are Jane Brodigan, Manager, City of Boulder, Tom Carr, City of Boulder Attorney, and Pat O'Rourke, Chief Operating Officer at CU Boulder. Jeff, would you like to begin?
Yeah, thank you, Mike, and thanks to everybody who's attending today. I wanted to just provide some background. So our case counts in the last 2 weeks have been much higher than anything we've seen previously. And in the past 10 days specifically, we've had 6 days with over 50 new reported cases, and the large majority of which are students. Obviously, the spike in those cases is very concerning to all of us, the City of Boulder, the university, our residents, Boulder County Public Health, the State Health Department, and also to our students. We've heard from many of our students about their concerns around the cases as well. So we've been partnering with the University of Colorado and Boulder, City of Boulder, as well as the Colorado Department of Public Health and Environment to take some swift action, as you saw in the media release last night. Yesterday, we notified the university that we feel pretty strongly that we need a 14-day self-quarantine of all students. And the university, the city, and the state health department were fully supportive of that action. And we felt it's important to do this and do it quickly to interrupt the spread. It actually follows a Michigan State University strategy that was put in place, and it provides us some additional time to implement some of the strategies in addition to this that we're working on. We also know it's critical that we have student support, and we know that many students are being responsible and they are taking action to protect themselves and others. And we want all students to do that in order to be able to move forward safely. In addition to the Colorado Department of Public Health, the University of Colorado, Boulder County Public Health, and the City of Boulder, we partnered together to provide 2 new testing locations that I think you're all aware of. The first testing location is actually up and running right now. It's at Pleasant Street parking lot, which is on 1205 Pleasant Street in Boulder. I've already had texts from my staff saying that it's going well, and we've got folks there at that testing location. The other testing location will be at the Gerald Stasio Ball Fields, and that address is at 2445 Stasio Drive, and it's going to be in the northwest portion of the north field. That site is not yet up and running, but will be up and running by the end of the week. And all that information is available on our website, so people will be able to get access to that pretty readily. Both of those sites run from 9 a.m. to 3 p.m. They're going to be open 7 days a week. And they'll be there for at least 2 weeks. The State Health Department is supporting us by running the samples and running the operations. And there's support at both sites from the University of Colorado, as well as from the City of Boulder and our Office of Emergency Management at Boulder County to staff those things from an operational standpoint. It's one of the things I wanted to make sure that I'm being really clear about is, as I've presented in city councils and in other places, I kept emphasizing the same message, which is we have to maintain 6 feet social distancing. Boulder County Public Health, the university, the City of Boulder, the state, we can't all be everywhere. And it's really up to individual behaviors. to be able to control the spread of this virus. It's critical as we move forward. So maintaining the 6-foot distance, wearing masks, making sure that we're sticking to good hand washing, and doing that often, as well as not gathering in large groups is critical to us being able to move forward and control the spread of this disease. We obviously are not in a place yet where we have a vaccine that is ready to be distributed widely to the community, and it will take time for that to happen. So we have some months in front of us before we're actually in a place where we have the ability to see more of that. So that prevention that we all need to take responsibility for is critical as we move forward. And it's not only critical to stop the spread of the disease, but it's also critical because if this disease continues to spread, we know from the data that we have in Boulder County that it has had serious and deadly effects on our highest risk populations. Not only can it have serious health implications, but it has serious implications to our economy, to our society, and to our other public and private schools. We know that kids need to be in school to get the best education they can and be able to continue to move forward. And we need to be able to control the spread of the disease so that we can allow all of those things to continue forward in our community. And that's why we feel like it is really important to have this 14-day quarantine in addition to some of the other activities that we've put in place. At this point, I'm going to stop and I'm going to turn it over to Chancellor DeStefano, who I know has more information for you.
Thank you, Jeff, and good morning to everyone. Our partnership and our collaboration with the city and Boulder County Public Health is vital to navigating our current circumstances. We've been working diligently to address the rising case numbers. We know that the vast majority of our students are doing the right thing to keep our community safe, and we're grateful for that. Even so, we've had enough of students choosing to gather in large groups and choosing not to wear masks. Because of this, we're facing an alarming rise in the number of cases that we see. As announced yesterday evening, we will fully cooperate with the Boulder County Public Health recommendation by initiating the 14-day quarantine period for students living in Boulder. We are taking these steps to protect the health and safety of the community, as well as to protect the university's ability to continue to provide an on-campus, in-person learning experience for our students. Even though students are not allowed to gather for social purposes during this period, it is very important for us to support students through this time. We want to make sure that the social, emotional, and mental health needs are met. And additionally, virtual events and programs will be offered to support students to engage outside of the classroom in the safest way possible. Because of the serious public health risk involved, students found in violation of COVID-19 protocols that endanger our community will have strict enforcement, the strict enforcement of the Student Code of Conduct and the campus health and safety policy, which may include expulsion from campus, probation, which can impact future study abroad or attending graduate school, and suspension from the university pending adjudication. I'd like to make sure that the group knows my Chief Operating Officer, Pat O'Rourke, is with us, who will answer most of the questions since he's been the most involved with the state, with the city, and with the county. Thank you.
Thank you, Chancellor. Now we'll get to the Q&A session. If you have a question, please raise your hand via Zoom and we will get to you. We'll start with questions for video participants, and then we will go to people on the phone. So when you speak, please announce who you are and what your organization is, along with your question. We will get started with Jesse Aaron Paul.
Hi, folks. Thanks so much for holding this availability. We asked the governor yesterday what threshold there might be for making the decision to stop in-person classes at the University of Colorado. And I wonder if you could provide some insight on what that threshold might be, and also, how close you guys feel like you are to getting to that point where you need to take that off ramp.
Jesse, can you tell us where you're from?
Sorry, I'm with the Colorado Sun up in Denver.
Hi, Jesse. I'm happy to take that question as a start. So yesterday, the governor's office and the state health department released what's called the dial. My guess is most of you are familiar with that are here on the phone. And the dial has 3 requirements, depending on which level of the dial you're in, all the way from protect our neighbor on the safest side, up to safe at home, which is where we started in this response back in this early springtime. And there's levels associated with each of those. And what we are doing is following the levels in that dial to advise the university on what level they're in, and then what we are approaching in terms of cases. In addition, we don't want to actually move up that dial. We want to stay where we're at, which is why it's so important to control the spread. I think most of you are aware that in that dial itself, if we are in safer level 2 and we move to safer level 3, it doesn't only have restrictions for the university, but it has restrictions for our community, and how many businesses can be open. That impacts other schools as well. So we want to control the spread of this disease before we have to get to a remote situation. I'll see if Pat has anything else that he would want to add.
The only thing that I would add to what Jeff is saying is that the dial itself does have thresholds that the state and the county will be looking at based upon things like infectious rate, hospitalization utilization, and the other impacts on the healthcare community. We recognize that our decisions are intertwined with the overall community health. And so the decisions about whether or not to move to remote instruction would be things that we would not want to be doing unilaterally, that we'd want to be doing those in coordination with Boulder County Public Health to make sure that we're approaching this in the right manner. What we do know is that under the dial, that as it was proposed by CDPHE, it does anticipate that throughout the course of the dial, there will still probably be some type of in-person instruction that takes place even as the change in status shifts through the level because of labs and some other things that we are able to continue safely and without adding to the disease burden in the community. So far, we have not documented through our contact tracing the transmission within the classroom environment, and that it appears that the classroom setting has been a very safe place. We know that even if we move to remote instruction, we will still have students in the community, and we want to make sure that when we're taking action, we're not addressing it from the standpoint of that if we move remote, that there still won't be challenges with infection in the community and the need to be able to address those on an ongoing basis.
Can you guys say where you're at on the dial right now, and also to address that specific question, how close you feel like you are to getting to the point where you'd have to switch to abandon in-person classes?
We are at safer at home level 2, and our case rates, we do expect to go up over the next few days. There's, as you know, we just talked about, there's increased testing that's happening in our community. We are not necessarily, though, expecting hospitalizations to go up, especially with this age group. As we've seen statewide, we're not seeing a correlation from high level of cases in this up to 30-year-old age group, and then a correlated increase in hospitalization. So we're not anticipating seeing that. Even though our case rates will go up, there is a period of time at which we have to be able to bring those down and stay either where we are in safer level 2, or potentially even move back to a lower level than that. If you look at our case rates in Boulder County, our case rates for non-CU students are pretty consistent and steady. So us focusing on this like we are right now is a key to us being able to not only stay where we are, but to be able to even move to a lower level.
Okay, thank you, Jeff. Next up, we have Jessica Snellwart. If you could tell us where you're from and your question, please.
Jessica, we can't hear you.
I'm sorry, Jessica.
Still
You're
hear you,
not.
Jessica.
Are you there? Okay, it's not working. All right. You could call in. We could get to a question from you that way. Let's go to the next person on the list then. Can we go to Elizabeth Hernandez, please? What organization are you with, and what's your question?
Hi, thanks. I'm Elizabeth Hernandez with the Denver Post. My question is, how is this suggested quarantine where students can still go to class and go to the recreation center and things like this different from what was already suggested of, students not, essentially just asking students not to party?
I will start with that, and I'm also going to make sure that I open this up to our attorney who's on the phone, Trina Ruland, to add anything in addition to what I might say here, or obviously to Pat as well. So the requested self-quarantine is much more restrictive. So we're asking students not to go and go out to eat or go do other things, to really stick to essential services. The reason that recreation is in there is because we felt it was critically important for people to be able to get exercise. This is a really stressful time for everybody, and to do that in a safe way. And I know the university has thought carefully about that, but this really is restricting to more things like medical services, are only a few key things that people can get out and do. We really do want students, for the most part, to stay where they are, to isolate and to not gather with other groups, because that's what will best help us control the spread of this. And I'll see if Pat or if Trina have anything else to add to that.
Trina, do you want to go first, or do you want me to jump in?
The only thing I would add to that is that, under the safer at home order level 2, groups of 10 are permitted to socialize. We're asking students not to socialize at all, not with one other friend and then move on to another friend. So that is a big difference between safer at home and the requested self-quarantine.
Correct. And from CU's perspective, it is a change in posture. Before, we had been looking at violations of public health orders as being the trigger to be able to get to enact our disciplinary process and those did allow some gatherings, particularly of up to 10 people. We were having some challenges with enforcement related to this. We have communicated the expectation as a directive from the campus that gatherings of any type now could be a trigger for student disciplinary action. And as Boulder County has reduced the range of activities that it considers to be permitted of our students, both outside of their homes and in the residence halls, we will be able to increase our enforcement as well. What this does recognize, though, similar to what Trina just recognized, is that even when the state was in safer at home, there were some activities that were not only permitted and necessary in order to be able to help maintain the needs and mental health of the community, such as some exercise, the ability to be able to access essential services, the ability to be able to seek medical care. And we know that it will pose challenges, and we want our students to be able to access mental health services, to be able to attend classes, to be able to keep them moving productively towards their degrees, and to be in a position where we are really trying to address what is the root cause of the spread, which is the social gatherings that have been taking place off campus.
And Pat, I would just add on the rec center, it's by appointment. It's not as the usual rec center where students come in at any time that they want to, but it will be by appointment, which will limit significantly the number of students. But we felt that exercise was as important both physically and mentally.
Okay, thank you. We'll go to our next question here. Paulo Zialcita, can you tell us what organization you're with and your question, please?
Hi, this is Pablo Shalsado with CPR News. I'm seeing a lot of talk on social media and from faculty and staff who emailed me who are criticizing CU for their latest statement. It sounds like they're saying CU is blaming students for COVID-19 spreading on campus. And I was wondering if I could get your response to that.
So I don't believe that that is an accurate characterization. This is not a situation where we're addressing it from a standpoint of blame. What we are trying to do, though, is communicate that we need the students' help and compliance with the expectations that are not just the university's expectations, but that are in place from public health authorities in order to be able to address the spread of the disease. And that we have recognized, because the data supports it, that there are behaviors that students have engaged in that are contributing to that. It would be irresponsible for us not to be in a position where we are asking them and very clearly demonstrating what those expectations are and letting them know that there are consequences, not just for them individually, but also for the entire university community, including the students who are, in fact, complying with the recommendations for masking, social distancing, and their behaviors. We need to be in a situation where we are supporting the behaviors of many, many students who have worked and been really diligent to obey the guidelines and address the conduct of those that are engaging in behaviors that are not only harmful to them individually, but that could be harmful to the community. And that's not an exercise in shaming, that is an exercise in being able to treat them like adults and demonstrate the expectations we have for them.
And again, when you consider the number of students that we have at the university of over 30,000, as Pat said, most of our students are in compliance with the public health policies of wearing masks and social distancing and so on. And so this is not a blame on all of our students, but as Pat said, the data certainly has indicated an increase in the age group of our students on the campus.
Correct. And I think ultimately we're not taking these steps in an effort to try to shame or blame students. We're taking these steps to protect the health and safety of the community as well as the campus, and to protect our ability to continue to provide learning experiences for all of our students. But we can only do that if our students assist us, and we need that assistance.
What amount of responsibility does CU take for the spread on campus then?
So I would respond to that question by saying we are acknowledging that we have the spread within the community. We took steps in order to try to mitigate that over the course of the academic term, including the testing, monitoring, contact tracing. We knew that we were going to get cases from the from the beginning, and we built the capabilities to be able to address those when they arose. The spread of the disease in the off-campus community has always been something we knew that we would have to address, and we've always planned for that we may need to change status based upon campus activities and what's going on with COVID in the community. We're at a point right now where both the campus and the community, through the public health authorities, have recognized that we need to step up what we're doing in order to be able to further mitigate spread. And that's what we're doing, and we need to be responsible for taking those actions at the appropriate times.
Okay, thank you. Katie Langford, can you tell us what organization you're with and your question, please?
Yeah, this is Katie from the Daily Camera. My first question is, early on, several campus officials said that testing off-campus students would not provide significant public health data. Do you still think that's the case? And can you follow up on if not, why?
So Katie, let me reframe, because I don't think that what we said is that we did not think that the testing of off-campus students during move-in was going to provide us with significant data. We have been testing off-campus students, and in fact, the majority of the positive test results that have been returned for CU students have been for off-campus testing. So we have been testing off-campus students. We will continue to test off-campus students, and that we have added capacity to the, with the assistance of the state. Our primary concern had been testing the residential student population, because that was a population that we had the ability to be able to focus resources towards, but that we have always planned to be able to scale up to be able to provide more testing. And the increased capability now is providing useful information and will continue to help us be able to partner with the county and the state to be able to respond quickly. And as Jeff Zayak said a few moments ago, the testing sites that have been made available both today and increasing throughout the week are going to continue to add to our capabilities and knowledge.
Thanks, Pat. So I just want to be clear that do you still feel like not testing off-campus students during move-in was the correct decision?
I do, because what we found is that over the first several weeks, we did not see cases being brought back. What we knew that the students were going to be returning to the community because of their leases, irrespective of whether we tested them. What that has happened is now we have some evidence of community spread that we need to address, but that creating a testing requirement on move-in would have given us a picture at one point in time. And what we've seen now is that it's not a one point in time picture that's important. It's having an ongoing holistic picture about what's happening in the overall community.
Hey, thank you. I understand we have a question from Nelson Garcia.
Thank you. Nelson Garcia with 9 News. Obviously, you guys are talking about changing the behavior of students in order to address this problem. I understand the university policy and enforcement, but do you guys really believe that it's realistic that students will change and stop attending parties on the Hill?
Do you want to take that one first?
Sure. So the answer, Nelson, thank you for the question, is what students have expressed to us is that they want to be able to continue their educational experiences, and that it was important to them that they have that opportunity. The action that we're taking in coordination with Boulder County Public Health, with the understanding that if it is not effective, that the county will have to consider more stringent orders and put those into place, is meant to be able to communicate very clearly that if they value that experience, which they have told us again, that they have to modify their behaviors. What we have seen, I believe, is that they may not have understood the gravity of what we were trying to communicate. I don't believe that based on what was communicated in coordination with the county yesterday, that there is going to be a lack of clarity. We are going to be stepping up what we're doing from an enforcement standpoint, but we need them to clearly understand what the stakes are and that we are updating campus policies and modifying our protocols to be in the best position to be able to demonstrate to them that their personal accountability and responsibility are part of this. And I think it is important to note that there are some organizations, for example, there have been some of the Greek residences that have now been under formal quarantine orders from the county that will have an impact, and that we are noticing that once there are formal conversations and disciplinary actions that are taken with students, those do tend to modify behaviors. So we're seeing few repeat offenders, but we need to remain very diligent to try to help modify those behaviors.
I think the other point that's important is that, in our student affairs area, once that they've had the opportunity to have formal conversations with students about modifying behavior, we've seen changes in behavior. So I have confidence in the student affairs, student conduct individuals that will be working with our students, that in fact there will be behavior changes.
Jeff, did you want to add in why you took the approach that you did to address this with us this way?
Yeah, I definitely want to add a little bit to that. So one of the things, again, that you've heard me say, no matter where I'm presenting, is that this comes down to individual behavior. And it means that if people take individual responsibility, which we know, again, as you've heard, that most people are, like I said, we've heard from students over and over again about how important this is to them. And we know we have some work to do with some students. I think it's really important that we engage students. We talked about this. There has been 3 work groups that have been set up. There's been a lot of work that's been happening between Boulder County Public Health, the university, the city of Boulder, and the state health department to really think through how do we do a better job at linking communications. We've talked about webinars for Greek houses so that we have more information getting to them more timely. We've talked about a communication liaison to all collegiate group houses as just 2 examples of ways that we want to engage students more in being solutions in this problem. And we don't know for sure what will happen, obviously, but we want to give it a shot and make sure that we are fully engaging our students in being part of this solution to this problem. So that is just some of the things that we've been talking about. And we're hoping that the implementation of those things will, along with the 14-day quarantine, will help support getting us moving in the right direction.
I respect that, but there are some people who believe that going to parties is part of the college experience. Even if you have 95% of the campus following protocols, that still leaves 1,500 students who can go and socialize and still spread the disease. It just seems like, from a mathematical standpoint, it just seems unrealistic.
The only other thing I would add to that is I know, and I think this is a question for the university to answer, but there's been a lot of coordination around looking at what is the disciplinary actions associated with that smaller percentage of folks that just are not going to change behavior. And I would leave it up to the university to talk about what that looks like. But again, there's been a lot of conversation, especially over this last weekend, relative to this.
And I understand what you're saying, Nelson. It is going to be our job to try to identify those people who are unwilling to conform their behaviors and to be able to address that. What you are describing, though, is not a situation that is entirely unique with university students, and that in the broader range of society, you have people who will not engage in social distancing, who have not engaged in wearing of masks. And so I don't want to be in a position where it sounds like students are the only people who have been unable to conform their behaviors to what are the best practices out there for addressing COVID infection, but that we recognize our responsibility to try to help address those as we're moving forward. And I think it's important for us to remember that for a lot of these off-campus students, they're going to be members of the community, and that just saying we're going to suspend them doesn't necessarily lead to a reduction of disease in the community. So we want to be in a situation where we're using discipline as a tool to be able to address behaviors, but also recognizing our overall responsibility to try to change behaviors to support the health of the community.
Okay, thank you. We're going to try to take some questions from the phones now. So we're going to unmute the phones. If you have a question, join in, tell us who you are and what your question is, and we'll see how this goes. Anybody?
Hi there. Can you hear me?
Yes, we can.
Okay, this is Jessica Snowert. My microphone was not working earlier on the Zoom, but I had a question. My name is Jessica Snowert. I'm from the Gazette in Colorado Springs. And, you know, you guys talked about the fact that a lot of the transmission is done with off-campus students. So I'm wondering, how much control does the university have over reducing transmissions with that section of the population?
So we have the highest degree of control in our own residential settings in our dormitories. That's absolutely true. But we don't distinguish between, in terms of our student code of conduct and the expectations of our community, between our off-campus students and our on-campus students. It would be a mistake for us to be able to say that we don't have the ability to be able to affect and influence the behavior of off-campus students. And as the chancellor recognized earlier, we have the vast majority of our students who are following the directions that we're providing to them and engaging in safe practices. For the remaining off-campus student population and the organizations with which they belong, we're working to be able to address them, and the partnership we have with the county, as well as the way that there has been really wonderful coordination and collaboration with the city and the Boulder Police Department to work together. Enforcing student conduct doesn't have geographical boundaries. We're also doing things like working with the landlords who rent houses on the hill to be able to enlist them and to be able to help us with addressing these behaviors. And the city itself is putting some properties through its nuisance abatement processes. So there are a lot of different angles that can be used to address the off-campus student population. Part of them are within CU's control, part of them are within the county's control, some of them are within the city's control. And by working together, we want to be in a position where we're using all the tools that we can to help limit spread of infection.
I would just add, to sum it up, that the key to for our off-campus students is the collaboration that we have with the city and with the county. That the three of us working together and the collaboration between CU's police department, CUPD, and Boulder Police Department. That has been, in my mind, has been and will be a key to the success, and that's the collaboration piece.
Okay, thank you. Do we have any other phone questions right now? Okay, let's go back. We have a couple repeat questions here in the room. Jesse, Aaron, Paul.
Hi, it's Jesse from the Colorado Sun again. So you guys talked about students knowing the consequences of their actions on this. And I think it's been known for a long time among students about the suspension and the potential police involvement. But I'm not clear exactly what the potential public health consequences would be. And I know in a letter this morning, you all referenced a mandatory stay-at-home order. I don't know how that would look. Can you provide us more information about what public health consequences there could be from a guidance standpoint or a directive standpoint if things don't get better after this 2-week period?
I'll start, and then I will kick this over to Trina Ruhlin, who's our county attorney. The first thing is that we absolutely are hoping that this will work in this 2-week period, along with the other strategies that I was referencing a little bit there. If it doesn't work, we will consider what other orders can we move forward with that will control the spread of the disease. The bottom line is obviously we want to control the spread of the disease. We want to keep our community healthy. We want to be able to keep maintaining the same levels of community activity that we've been able to maintain up to this point. But I will see if Trina has any thoughts specific to your question that I might not have touched on yet at this point.
So the strong recommendation, we're really relying on the university's disciplinary system for that, which, as the chancellor mentioned earlier, has been very effective. If this comes to the point where we have to mandate a public health order, the public health statute dictates what the penalties are, and there are both criminal and civil penalties for violation of any public health order. And that could mean either going through a criminal prosecution process with the DA's office and being either fined or jailed, and through the civil process, it could mean being subject to a fine or injunctive relief.
Okay, thank you. Katie, do you have a follow-up question? Katie Langford.
Yeah, I wanted to follow up on one of Jesse's first questions about how close CU is to switching to a different state of learning, like going all remote.
So I don't know our current case rates as of today. I believe we were at our case rate, one of those measures from the dial. I believe we are at 172 per 100,000, which if you look at the dial, that would actually be in safer level 3 again. We would have to be in that for more than a 2-week period before we would get switched to that level. Again, we do expect that those case rates will continue to go up as we do more testing in the community. We are going to find more positives. In terms of the test positivity rate, our test positivity rate is 3.6%, I believe, as of yesterday. We do not anticipate that the test positivity rate will significantly increase, because as we increase testing, we anticipate that we will not find a large number of positives. Most people will be negative, and that will drive our test positivity rate down, is what we are anticipating. And then, as I had mentioned earlier, our hospitalizations, we are not anticipating that we're going to see a significant increase in hospitalizations. Even though we have very high case counts, because of the age groups, we haven't seen a correlated increase in hospitalization. So if you look at those 3 primary measures, we are likely to remain in safer at home level 2, as long as we can control some of the case spread that is occurring over the upcoming weeks.
And Katie, if I could add, when we're partnering with the county, we are looking at the cases as they arise. We will be making decisions about if there is evidence of the spread of infection within the classroom environment to be able to use isolation and quarantining for classes as necessary. But in terms of a wholesale wholesale shift of status, that is going to be driven by the factors that Jeff was just describing in order to be able to look at it. But through our contact tracing mechanism, we are looking at each of the particular classroom environment for any evidence of outbreak in the classroom. And that so far we have not been able to determine that the mode of instruction is creating the incidence of disease.
So just to clarify, it sounds like the university's decision-making as far as going remote is pretty closely tied to the county status as well as classroom transmission. Is that correct?
Absolutely.
Okay, thank you. And Elizabeth Hernandez, do you have another question?
Yes, thank you. I see in the chancellor's message to the community, the chancellor has said 422 students have been referred for student code of conduct violations due to not following public health orders. Is there any breakdown of what that means? Are those students expelled, or what does that mean? And if they are expelled, are they just like, do they, not get their tuition back, I would assume, or what does that mean for students?
So first thing that we have to do is distinguish between referrals and cases that have been adjudicated. When cases get referred over to student conduct, then that gives them the ability to be told they have a charge against them, and that they would then have the ability to be able to provide evidence that they're not in violation. So those are the number of cases that are currently have been referred over to be part of that process. Some of those cases are more significant in terms of people who have hosted a party or have done things that are creating a greater threat to the community. And those are the ones that have been subject to exclusions from campus. We have some cases that are more minor, such as that the students are in a residence hall and they're not wearing a mask. The off-campus cases have tended to be more significant, and those have led to exclusions for a 2-week period of time. We are addressing other repeat violations by stepping it up in terms of them having facing the possibility of suspension. But what we have seen is that so far, through the initial contacts that we're having with students from a disciplinary standpoint, we're not seeing repeat offenses. So we know that that conduct process is having effect on student behaviors. We just need to continue to have that effect and move it up.
So to clarify, there have been no students expelled over public health orders?
I'd have to check with our student affairs office, but I don't think that we have removed students permanently from the institution yet. We've had temporary exclusions, but we have not yet gotten to the point where we have had permanent exclusions.
Hey, Mike, you're muted.
I'm muted. Looks like we have one more follow-up question from Paulo, and then we're going to have some wrap-up statements by the Chancellor and Jeff Sayak. So, Paulo, can you tell us your question, please?
CPR News here again. At a press conference with the governor a week or two ago, CU President Mark Kennedy, he said that CU was prepared for an uptick in cases and prepared for a possible outbreak in the campus community. But I'm wondering if CU was actually prepared for 441 cases in the found in the campus community less than a month into the semester. Is this what you were planning to be at by now?
So I will answer that we hoped that we would not be in a situation where we had this number of cases. We were prepared that we might have a significant number of cases that got returned. We are still able to use the support mechanisms that we have like the contact tracing capabilities that we've developed. We're still using the isolation and quarantine spaces that we have on campus. But it's not so much the number of cases that is the greatest concern to me at the moment. It's how quickly we've escalated in terms of those number of cases that are being returned on a daily basis right now. That leads us to the point where we are at the moment where we need to be able to partner with the county to be able to create a greater set of expectations.
Excuse me, I would just add to that the monitoring approach which we've taken, which includes the wastewater testing, is also part of our public health response to identify cases of COVID early and to take action to minimize the spread. So my assessment is that we obviously, would like to see fewer cases, but what we've had in place since the summer and working through the fall, and now with the increased testing that we will have and increased contact tracing, and this 14-day quarantine, which if you look around the country is not unusual. More and more institutions are saying that, not only Michigan State, but the University of Arizona, the University of Wisconsin. So we're prepared, but we definitely, in my mind, we've seen more cases now than what I was expecting. I was expecting it to be more later, but at least this gives us now the opportunity through this 14-day quarantine to get back on the right track.
Okay, thank you. Unfortunately, we're about to run out of time. I know there's a couple questions out there still. If you have questions, you can please email Chana Guceres. Her email and name is in the invite that you received. And we're gonna turn it over now to Chancellor DeStefano for any closing statements.
Well, thank you. I just wanted to thank everyone for being on this Zoom meeting. And I just want to stress one more time the importance of the collaboration that we have with the city and with the county, and also with the state, and the state helping us with the increased testing and contact tracing will definitely move us, I believe, in the right direction. So again, I want to thank everyone for being on the Zoom meeting today, and thank our partners in the city and the county.
Thank you. And Jeff, do you have some comments to wrap up this meeting for us, please?
Yeah, I would echo what the Chancellor just said, and our folks on the City of Boulder who are on here today haven't had much chance to respond, but they've been critical partners with us, and their police chief, their city manager, Jane Brodegam, have been absolutely key in being able to do what we have done up to this point with the university. So I want to just thank again the partnership, and my parting message is still very much the same, and it is really imploring folks to follow the guidance, to really do not gather, maintain 6-foot social distancing, wearing masks and hand washing can prevent this from spreading further. That is the message that needs to be out there. Again, we can't all be in every single place all the time, and it really does come down to those individual behaviors. And the more we can follow those individual behaviors, especially as we move into the fall with flu moving in upon us, it is going to help us control both sides of the spread of this disease as well as flu. So I want to thank you all for being on the call today and for asking great questions, and appreciate everyone's time.
Thank you, Jeff. Once again, if you had questions that you were not able to ask, please email Chana Guceres with Boulder County Public Health. Her email is in your invite, and we thank you for joining us today.